Today we're going to talk about heel pain, which is a common issue that we see with skiers in particular, sometimes with snowboarders also, but specifically ski boots is the question that most people have. And they want to know, is my boot a problem? Is that why I'm having pain? Or is there something going else? Is there something else going on? So I have a microphone so you can hear me. So people coming in, they want to know, is there something wrong with their boots? You know, they have boots that they may have wore in a prior season, or they just switched boots, and now they're having heel pain when they're skiing. So first thing is your boots do need to be properly fit, right? And that's there's specialists that do that. We want to make sure that you're getting the right fit for you. We want to make sure that we're scaling the right appropriate level of boots for you, depending on what your skill set and the way that you like to ski. But if they're only bothering you in your ski boots, that might not just be the boot fit, it might actually be the activity you're doing. When you're wearing ski boots and you're trying to ski, you're trying to move your shin forward over your foot. And when moving your shin forward over your foot, that's putting more tension on the back of your calf and under the base of your foot. And that motion can create that heel pain that people commonly have with skiing. So good news is, it might not be your boots. If you've had your boots properly fitted, don't throw those boots away. You need to do some other work outside of skiing, and that will help you to have a more comfortable fit for your boot. When we're trying to identify what is the cause of your heel pain, the three most common things we see is either tension in the calf muscle, and that gets too short and that creates pain in the front of the heel. It could be tension in that plantar fascia, in that big connective arch, and if that doesn't have the flexibility, that gets stressed and becomes painful in the heel. Or it could be nerve compression right behind the inside part of the bony part of the ankle. This one can present just like heel pain. So it's important to diagnose what is causing these, because they can all have the same presentation of pain in the heel, and they can all have that same presentation of being stiff and most painful in the morning. It tends to loosen up as the day goes on. First, a lot of people will figure out how to treat their arches themselves, and they might try something where they're rolling around on a ball. They're trying to stretch that out. So we would just take a ball, and you can use any sort of lacrosse ball, a golf ball, a baseball, and you're just kind of rolling that around. When you're doing that, not only do you want to roll heel to toe, but you also want to roll side to side. We want that connective tissue to spread out. We want to feed slack into that tissue. So that'd be the most common thing that people are going to try first thing. Now that's going to feel good when they're doing it, but it's not going to solve their problem. So at that point, then they're looking for more things. And some of them might realize that they want to stretch their calf. So there's a variety of ways we want to stretch our calves. It could be leaning up against the wall. It could be down into a hands and knees position, stretching the calf. It could just be bending forward. And you can see as we bend forward and stretch that calf, this gets me into that shape that I want to be in when I'm in my ski boots, and I'm pressing my shin into the front of that boot so I can get my edges engaged more. So this is an important motion that we're not doing a lot in our normal day-to-day, and then when ski season comes around and all of a sudden we're intentionally trying to do that, well, we don't have that flexibility, and that's creating pain in the heel. So if we're only treating the heel by rolling around with a ball or icing it or trying heat or whatever other modalities, and we're not stretching that calf, that pain continues to come back. In the morning, it's stiffest because it hasn't moved very much, and then as you walk around a little bit, it starts to soften up, and you start to feel a little bit better with that motion. So this is going to be people that might feel a little bit tight and uncomfortable when they first get in their boots and they start walking around a little bit. They might ski a little bit. It might loosen up some for them. But then that night or the next day, they're really feeling a lot of that heel pain, especially first thing in the morning. The third thing, and this is the one that people are least likely to figure out on their own, is that there's a nerve that runs right behind the back of the bony part of the ankle. And if there's tension and pressure there and that nerve is compressed, then that's going to present as heel pain. That nerve comes right down and innervates right in front of the heel. But we really want to get that tissue to move. So some massage back there could be useful for that. We like to use techniques where we use a lacrosse ball and we're twisting and tacking that tissue and then moving back and forth there. And as you do that, you might find some things that are a little bit crunchy, a little bit uncomfortable, but good uncomfortable. It should be relieving with that. And we want to get that nerve to move around. We can even use the stickiness of the ball to kind of move that tissue around. So anything behind that bony part and underneath it. So in this L shape right here, and only on the inside of the ankle. This isn't really an issue on the outside of the ankle. But those are areas that we want to work on and make sure that the connective tissue on the bottom is flexible, the calf has the mobility it needs, and that this nerve is compressed. And that'll solve heel pain for a lot of people. So this is an area that we're definitely going to want to work on, that people are generally going to work the back of the leg and not the front of the leg. So we want to make sure we address that. We'll also see in this diagram that this is the inside edge of the ankle where we talked about that nerve that runs through there. So there's a lot of structure that runs through. There's a lot of muscles that come through and hook around that bony part of the ankle. And one of those things is that nerve. And that nerve comes right down and can create that heel pain. So we want to make sure that all those muscles, that artery and that nerve are all moving freely through that area. And then as we get into the depths of the foot, we can see underneath the base of the foot, there's a lot of connective tissue and muscles there. And that's all covered by that thick connective tissue, that plantar fascia. So it's kind of hard to get in there and work for those things. But these are the type of things that we want to make sure that the arch dynamics work well, that we're having activation of all these muscles, because these are going to create stability in that arch. And this is going to alleviate foot pain for a lot of people because they don't have good arch support, they don't have good biomechanics. And it's important that we correct those things rather than just treat the symptoms or possibly changing out boots, which is frustrating and expensive and time consuming. So if we can get your foot functioning better, your boot's probably functioning just fine. There is occasion that you might have a bone spur going on in the heel, and that is from a prolonged stress of that plantar fascia, that connective tissue pulling on the bone. And as that pulls away and that space opens up, your body fills bone into there, and that creates a bone spur. Now that is something that can be painful. It sometimes might need more of an intervention, but it would still be worth trying to figure out how to soften the tissues around that, feed some more slack into that system, and then relieve the pain without any other intervention besides that. So one of our considerations is that there's compression of this nerve that's resulting in pain in front of the heel. We want to decompress that area. So we talked about already doing some tissue work, softening any tension in there, making sure there's mobility and everything can move freely through that area. One of the things that we can use for decompression is cupping. So we can just take these little silicone cups and we can put them right in that spot where we know that that nerve is, and we can just kind of suction them on there, and we could just even leave them on there, right? You can imagine that they're decompressed and they're pulling everything away. We might play around with them a little bit, give them a little bit of a pull, right? We might just leave them on there for a minute or two while we're doing some tissue work up into the calf or some down into the base of the foot. And we know that that nerve is just getting decompressed. So that's a good way to tell, is it a compression injury? A lot of times we're doing techniques where we're pushing and we're doing compression, right? But maybe sometimes we need decompression. So we can kind of work through that area. We might get a little red mark. That's usually a good sign. That means that there's some tissue activation happening down there. There's some tissue changes happening underneath there. So we could use cupping to kind of decompress that nerve pathway, and that should be relieving of symptoms when they're present. So after we've gotten your tissue mobility and we've taken some of the pressure off of that area, we want to create some strength and stability to make it less likely that that problem happens again. So there's a couple exercises that we'd like to do. One of them is we want to reinforce that position that we've worked on stretching that ankle forward, right? So we can close down that joint. Now it's important that you're not getting a pinching in the front of the joint. If that's happening, that's something we would address in the clinic. But as you've opened up that motion, you're able to now shift that knee forward and close down that ankle more. We want to get in that position and we want to reinforce it. So as I load forward into that leg, I'm trying to pick up my toes now and more picking up my forefoot, because when I do that, I engage that shin muscle. And that reinforces strength in that position. So I don't want to only be strong in this position, because when I'm skiing, I want to be here, right? So I want to get into that position where I'm challenged, even beyond it if I can, and then strengthen that by trying to pick up that forefoot, which I'm not going to be able to do because I'm putting weight into my foot, but I really feel that into the shin, like I'm pulling it forward, and then maintain that tension as I press it back out. So this is a great exercise that we can do, that we can practice a lunge to get some strength into that front leg, but really more than anything, we're reinforcing that ankle position, lifting that foot up, getting strong at that end range of position, and controlling that throughout. So we'd love to give that one for skiers to reinforce that position that they can push into the front of their boots well. We also want to work on their balance, right? Usually when we're having some heel pain, part of it is that that middle of that foot is dropping down. So we'll see an arch that as we put weight onto it, we put force into it, that arch will collapse. So one of the exercises we might do is a short foot exercise where we're trying to strengthen the muscle between the heel and the big toe. And if we strengthen that and we engage that, you can see the arch lifts up. Now what's important is that we're not digging our toes in and curling our foot, right? But we're just pressing that. Just pressing the base of our toe down. This is a difficult exercise. Most clients don't figure this out right away, so don't be discouraged. Keep working on it, you'll get it. But once we have that arch stable, we need to learn how to balance over that arch. So an exercise that we might do could be standing on one leg with that arch active, where we're taking a weight and we're passing it from side to side. So we're controlling the inside edge, outside edge of the foot. Or we might want to add some rotation into what we're doing. So again, with the intention of that arch being stable, so we're going to set ourselves up, we're going to engage that arch now that we've learned that skill, and then balancing on one leg, with my hands on my hips, I'm going to rotate my hips and rotate my hips, because I want that arch to be stable when my hip is in all different positions, because that's going to happen throughout my ski day, that my hip is going to get into different positions, and I don't want that arch to fail. If I have strength in one position, but I get into a certain position and that arch fails, well, that's going to stretch out all that connective tissue on the bottom of the foot. That's going to create some of that heel pain. So those concepts of stabilizing the arch, using some some weight bearing and trying to pull that shin forward to reinforce that new position, and then working on some balance while keeping that stable arch. Those are some of the exercises that we might do that's going to help a skier be more comfortable in their boots throughout the day.